Okay. Well, again, good morning. So here we are, YHDP, the YHDP HMIS data and reporting requirements is what we're going to be talking about today. Quick agenda for us. We're going to go through the YHDP project setup. What do the projects physically look like in HMIS? What are the data collection requirements, both from the HUD perspective and a local perspective? You'll see that there are some differences. And then the reporting process that we're going to be going through. There's a couple different ones that you'll have to pay attention to throughout the course of the year. So we'll make sure to go over all of those things. Of course, at the end, we'll have an open question and answer. But like I said, please, if you have any questions as we go through, stop me and let me know. So we'll go ahead and hop into it. So we're going to go into the project setup. And we've talked about this a little bit already, but just to make sure it's documented, the way that we have decided to set up the projects is a little bit different for each of the contracts that we have. So the NAV collab or the SSO, you might hear me use those interchangeably, SSO standing for supportive services only, is going to be the project type, of course, is SSO in HMIS. If you ever see numbers, that's usually just the data element number. So project type 6, if you're interested. The performance outcomes that we're focused on with this particular program are permanent housing outcomes. So the reason that we've been given the grant is to sort of see folks succeed and exit to permanent housing. And that's any form of permanent housing. That could be doubling up permanently with a friend, or going back to live with family permanently. Anything that's considered a permanent destination. And of course, you have your rentals, and maybe you can own something, right? So those are some outcomes that they're going to be looking at, and that's sort of what we've been contracted to do. The way it's going to be set up in HMIS, each sub-recipient will have an SSO project within their agency. So we're going to have a total of 6 projects for the NAV collab, right? And I keep trying to list them and I always miss one. But you know who you are, right? If you're on the NAV collab, you've been in the meetings already, you know who you are. You have a project already available to you in HMIS. It's going to start something, it's going to have your agency name at the beginning. It's going to say YHDP, and then it'll say SSO, or I think NAV collab. I can't remember exactly how I titled it, but it is there. The transitional housing and rapid rehousing joint component is going to be a little bit different. So all the data is going to be streamed through LMM. And so it's going to have, there's actually 2 different projects. There's a project type 2, a transitional housing project, and a project 13, or a rapid rehousing project. They are not one project. They are not the same project. They're actually 2 separate projects. And you'll enter the folks into both, or one or the other, depending on whatever project those folks get into. The performance outcome, of course, is permanent housing, just as it is with the SSO. And again, only LMM will have these projects. So LMM will have 2 projects. It's just going to be under the LMM agency, and only LMM will be able to enter data into it. All right. Any questions about how that's set up? Okay. All right, that's the easy stuff, right? So now let's get into what's actually required of you. So the first thing we're going to talk about is privacy and release of information. Okay. So just as I just want everyone to be clear that, the OHS does absolutely they do care. We do care about the privacy and making sure that the folks that are input into the system have given informed consent. Okay. So with that being said, we have 2 things that you have to do to make sure that you are doing those things. The first is you have to have I have HMIS privacy postings. Okay. I will send them out with the PowerPoint at the end of the meeting. These privacy postings, and I'll show them to you while we're in here, basically go over exactly what we do with the data, how we use the data, who has access to the data, and it should be posted in any office space where you're doing intakes. Now, if you're going to be doing intakes and you're on the road, you don't have to carry them with you, because basically they go over what the release of information goes over, right? So the release of information should also be reviewed. When I say reviewed, I mean verbally explain it to the person that you are talking to and get informed consent that way. If you're not reading it to them, I wouldn't consider that informed consent. I'm saying not reading it, but verbally going over it with them, that's not informed, right? At that point, they're just signing a document because they're signing a bunch of other documents maybe, but we really want them to know what's going on and what they're signing up for. Just keep in mind that if somebody says we don't want to sign this, it does not mean you cannot serve them. You can still serve them regardless of consent in HMIS. However, that is not going to reflect anywhere in reporting. So just keep in mind that our numbers are going to look a little bad, or not bad, but different than what you've actually done, if you can't get informed consent from everybody that you're trying to serve. Okay. So you can get informed consent two ways. You can get it as a verbal consent, or they can actually sign the HMIS release. Verbal consent is just as good as the signed document, and both are good for 3 years. If one agency gets consent from somebody, that will cover the entirety of the continuum. But best practice is that each agency tries to obtain informed consent on their own. Okay. So somebody might go through the nav collab and maybe they touched 4 different of the subs, right? In the nav collab, all 4 should try to get consent. Okay. Even though if maybe LMM's team happens to engage them first, they get a 3-year ROI. That does cover everybody else, but we still want to make sure you all are doing your due diligence and have that on file in your own agency. Okay. So you'll need to keep that the paper form, or if you have it in your EMR, your medical record system, that's okay too. But you need to keep that for your files, and then I'll show you later where to enter that ROI into HMIS. Now you don't have to upload the actual document; you just have to put the dates in and that they gave consent. Well, again, I'll show it to you in a little bit. Okay. Any questions about that?
Quick question, Nick.
Sure.
So I was just thinking about having them sign the ROI like 4 or 5 different times.
Mhm.
Um, my Would it make sense, like, if they came, like, if because my thought is that we're going to be working very closely together in a nav collab. If, let's say, LMM is working with a youth or young adult, and they are transition to working with NEOC, right? Would it be possible for us just to make a copy of the ROI, explain to the youth or young adult that we're going to be, that, you know what I mean, that we'll be sharing that with them, so that they, you know what I mean, so they'll have it? Or I don't
Yes.
know.
So
Okay,
I'm fine with that. I think from just the policy and procedure perspective, like that's just the best practice is that everybody tries
gotcha.
to get their own. But if you find a way to sort of share that amongst each other, where that all of you can have it on file, I think that that would also be appropriate. So
Okay, okay.
yeah, Carrie.
Hey, so what I typically do when I like am filling out an app, I'll say like by checking this box, you're giving me consent to talk to this organization since you called coordinated intake this organization, and like really breaking it down like organizationally based so
Mhm.
that the client is aware of like all parties involved is typically what I do as like
We lost your audio there, Carrie. Sorry.
my onboarding. I'm sorry, I'm in no man's land, Michigan. So I'm sorry. Can you hear me?
Yeah,
Can
yeah,
you
we
hear
just
me?
lost
Nope.
you at
Now
the
we
end
can.
there.
Would that be okay as like how we're communicating, and then also just like letting the parties know?
Yeah,
Is that
yeah, I
fine?
think yes, I think that's good. I just, one of the reason that I say you need to have it on file is because if for whatever reason we get audited, that release will need to be somewhere in your file as well. So if you're keeping it and you get it first, Carrie, and then they get passed off to somebody else within the NAV collab or even to the THRH project, I'm okay with you as long as they have that paper form, because if they get audited, they'll need it too. Yeah.
If consent is obtained verbally, is only documentation then just what's entered in HMIS or is something additional needed?
Good question. No, so the paper form was still needed. So what you'll do, and again, we'll do this in a second, but what you'll do is you'll get the verbal consent. You'll write verbal consent given where the client's name would normally go, and then there's a witness signature where your name or whoever obtained the consent would sign off. So again, yeah, we'll show it to you in just a second. Okay. Any other questions about privacy or release of information? Okay. All right, let's actually get into that now then. Let me stop sharing. I'll show you first the privacy document. Hopefully you have all seen it. All right, are you seeing? You should be a Word document. Yeah, okay, let me roll it up here. Maybe not. Okay, so you might have seen this before. Hopefully you have it up somewhere. But essentially this goes over what we do, what is our responsibility to safeguard the protected information that you have given us. It talks about what we might use it for. This has come up a lot recently. Unfortunately, there's a lot of people looking for data from HMIS, and they try a lot of different avenues to get it, right? Public records request, which we don't consider HMIS data public record, but we've gotten it that way. We get media requests, we get all kinds of stuff, and so usually we rely on these documents to say what we do and do not do with the data. And so again, here, just this line is super important. You have the right to obtain services even if you choose not to participate in HMIS. So folks you can tell them that. But this will just be posted anywhere where you might have people come in and do that intake process with you, where they might be signing an ROI. Caleb, I see your hand up.
Yeah, I'm going a little backwards, but I was
Okay.
just curious if there's an electronic option to do the HMIS consent. Or maybe we would have to build one out in our electronic health record if we wanted that functionality.
Yeah, we don't have an electronic form. We just push out this PDF version. If you all can make it electronic, feel free. Yeah, that's just
Thank
we're
you.
not gonna do that here. Okay, so just write your name on here. Okay, your agency name, not your name, and post this wherever you need to. Okay, save that. And then everyone should be familiar with the ROI. Where is it? Okay, so again, it goes over the same stuff, right? It talks about what do we do? What do we collect? What type of information do we collect? What happens to their information? I think one of the most important things to just note with people is that when we share data, it's never their individual level data, right? We're sharing aggregate numbers, de-identified numbers. No one's going to know who they are, where they're at. This is just going to be big numbers. And we usually only do it to comply with some sort of reporting request from like a funder, right? Federal, state, local agencies that fund certain projects, or we will use it for the purposes of research or analysis, right? But again, nobody's going to know who they are, that they're homeless, where they're staying, none of that. Okay. And then this talks about why should you agree, right, to have your information shared with other people that are in HMIS. We reduce the number of visits to other agencies and the forms that you have to complete. So again, we require that you do it, but that this is a way to deduplicate the amount of times they have to sign the same document. We identify other services or programs you might be eligible for. Eligibility is huge. And as we move towards a more HMIS based way of even slotting for other COC resources, HMIS is going to be even more important for those folks. That's not to say that they won't get slotted if they don't consent, but it's easier to have it all in one place. And then, of course, it's better to coordinate services for them, especially with the NAV collab, with how many people are going to be working together and need to know that information. So you would just come down to the bottom, select if they authorize or refuse. You want to keep it on file, even if they refuse. And you can, if they say, I'm not signing anything, you can still do refuse, put verbally refused, and then sign your name. But otherwise, it's going to be authorization. Have the client sign their name, or the participant sign their name, date it, and then print their name. You also can print their name if you choose. And then you sign as the agency witness and date it as well. If you are serving families, all right, all of the names of the family members have to be listed below the head of household. If they are not listed, we don't have consent for them and we cannot enter the family. All right. So make sure that if you are working with families, that you have them print the names of the household members, what their relationship to the head of household is, and then have them sign. So we know that we can put that in. Yeah, Lisa.
Yeah, Nick. Is it possible for someone to verbally consent and refuse to sign?
Yes. Yes, that would just be verbal consent. So we would just
Okay.
have you print basically on this signature line here, right? You would just say verbal consent given, put the date yourself, and then you sign and date.
Okay.
Okay. It's a good question. Now there is going to be I'm maybe somebody's thinking it already, but there is the question of if we end up serving minors or unaccompanied minors, what does this look like? And I would just say you follow the same procedure that you do for your RIE projects, because it's going to be those of you that already have RIE projects that would be running into that, I assume. So if you get consent, do it the same way that you normally do. If not, those folks will end up being private anyway. For those you don't know, if you're an unaccompanied minor, when you come into the system, you end up your profile is automatically sort of locked in private. So frontline folks can't see what Lisa Smith and her team entered if that person is unaccompanied, an unaccompanied minor. All right, so I'm gonna stop that. And we'll get back to the PowerPoint. All right, we're going to get into some of the data elements. All right, you all can see my screen, I hope. Yeah, okay. All right, so the universal data elements. So these are elements that all HMIS participating continuum projects are required to complete in the system, or complete or collect. So I just put the element number here because I'm a nerd, but the other stuff is what you should probably worry more about is what the element name is. I have what applicable project, so whether or not it's the SSO or the THRRH, and then for who, so what persons need this collected, and then when would you collect it, okay? So starting at the top, obviously the normal identifying information: name, social security number, date of birth, race, ethnicity, gender, vet status, disabling conditions. You have to collect that for all persons, except for veteran status, but you have to collect it for all persons in your project, and that's all the projects. This is not specific to any project. And at least the first few here, right, other than disabling condition, is usually when you create the record. Okay. Now I think what you're going to run into is that you're probably going to be creating some more records than you might be used to in the past. These are the young adults, right, that may not have hit the system before. Now, best case scenario is they've gone through coordinated intake or something, and then you don't have to worry about entering in all of this identifying universal data element information. But there might be a point where you have to do that yourself. So this is when you would do it, as that record creation. Obviously, veteran status is only going to be for adults and not any children that might be in the household. Disabling condition, basically the way I have this set up is this is the data element, and if there's sub questions under that data element, I've put it in italics and sort of tabbed it for you so you can see. If somebody you say has a disabling condition, you'll have to then select what type of disability, and again we'll show that to you in just a second. I understand too, this is just as a disclaimer, I know a lot of you know this already or have been in HMIS, but because it's a new training, I want everyone to hear the same thing, and it's going to be posted. So I want to make sure that anybody new is getting that information too. Continuing on, universal data elements. So project start date, project exit date. Obviously, we need to know when people come and go. Project start date is for everybody at start. Project exit is for everybody at exit. The destination, so that's going to be a critical data element for you all. HUD is going to be paying particular attention to permanent housing outcomes, as we already talked about. So the exit destination is going to be really, really important for you to focus on and make sure that you have the right data in there. The days of, or if you have other projects where unknown or client prefers not to answer is pretty common, we're going to try to avoid that at all costs in this project. We want to make sure that we have accurate data. So you're going to collect that exit. Relationship to head of household. This is not necessarily something that you might input. The system might read this itself, but it is a universal data element that is required. It's for everybody, and usually it is at the project start. The next one is housing move-in date. This only applies to rapid rehousing. When the head of household ends up getting the unit, and I mean physically is in the unit, that is when you will enter the housing move-in date on that project. That is going to be something that you do when it occurs, but it lives on the enrollment assessment. So even if the person has been enrolled in rapid rehousing and has been receiving rapid rehousing services without having a unit for a couple of months, maybe, you have to go back to the enrollment screen and enter in the housing move-in date when that person receives the unit. I see a hand up.
So Nick, going back to the destination. So a lot of times, quite a few times I ran into where a person has just left shelter. So we weren't able to collect any information about where they were going. And since you don't want us to use unknown or prefers not to answer, what should we put there?
Well, I mean, if that is the truth, and that's the truth, and I mean, I'm not going to have you make anything up, but I do think that, with this particular project, I'm hoping that there's a lot more engagement with those families, that you might be able to gather that information a little bit easier.
At least have some idea.
What's that? I'm sorry.
I said, or at least have some idea.
Right. And the other thing that I think we don't use as a resource enough is HMIS. So like when somebody leaves your project, it's pretty rare, especially if you don't know where they're going. It's pretty rare that they don't end up somewhere else in the system. So you can always go back, keep checking in, check their profile, check their program enrollments, and then you can modify your exit based on what you see, right? So if somebody left your shelter and ended up in another family shelter or something, you could put the exit then as shelter. Now, it's still not positive, but it's better than saying we don't know, because that implies that they're not engaged, right?
Yep, got it. Thank you.
Caleb?
Yeah, I was just gonna make a comment that I assume maybe, or that the SSO will have more unknown destinations compared to THRH, but hopefully we can limit that to being rare if possible.
Yeah, I mean there is like a level of outreach, right? And
Right.
usually outreach doesn't have great outcomes when it comes to exit destination. So I can understand that. I wish it was labeled as street outreach, because then it would be a little bit better. But because it's an SSO project type, HUD's not really going to make that distinction, right? Even though we're doing a lot of outreach work within that project. All right. The last one here is prior living situation. And really, this is all the homelessness questions. We're trying to get at people's homeless history. This is required for every project, but it's only going to be collected for head of households and adults. Usually what happens is if there's children in the household, it just sort of reverts to what the head of household's information is. And you're going to collect this at project start. So you're going to select where they were coming from prior to the entry into your project. You're going to say how long have they been at that particular living situation. You're going to put a date of the approximate start date that this episode of homelessness started. So again, this is not the date that their entirety of their homeless system stay has started. This is the date of the current episode. So I want to make sure that's a clear distinction. And then you're going to enter in the number of times in the last 3 years that they've been homeless and the number of months in the last 3 years. Now, this is all self-reported, but if you have the opportunity to go into the system and you see that they said, oh, I've only been homeless one time, but you can see another episode, you have the autonomy to change that to 2 times, even though they've only reported 1. We want it to be accurate. If self-report's the only thing we have to go off of, great, then do that. But use HMIS as a resource as much as you can. Okay. Yes, Lisa.
Nick, will this information be treated differently for unaccompanied minors?
What do you mean by treated differently?
Well, it says for head of household and adults. So we
Yes,
collect this information.
yeah, the unaccompanied minor would be considered the head of household.
Head of household. Okay.
Yeah.
Thank you.
Mm-hmm. All right. Moving on. So now we're going to get into the common program specific data elements. And these are elements that are usually required by a specific program, but they tend to be common across a lot of them. Usually the differences the differences between the program is like funding source based, right? Or project type based. But these are required for your YHDP data entry. The first is income and sources. This is required for all the projects, and it's only going to be for head of households and adults. You're going to actually collect this at 3 different points in time. When they enter the project, when you complete the annual assessment, which in your case is actually, I think 3 or 6 months. I have to double check, which we'll look at it in the system in a second. And then at exit. Okay, so the reason we do that is to track, with all of these actually, is to track changes over time. And of course, we want to be able to see that folks are either gaining or maintaining income, non-cash, and health insurance over the course of their time with you. Okay. Income and sources. So if you select that somebody has income, there's going to be a whole list of income sources that you'll have to choose from, and you'll enter in monthly income. And we'll go over that in a little more detail when we get into the system. You're going to talk about non-cash benefits, things like SNAP, WIC, things like that, it is money, but it's not cash in their pocket benefits. And then health insurance. So what type of health insurance do people have? And again, there's a whole list of them to choose from. And then domestic violence. So we do have to ask the domestic violence questions in this project. It's going to be for only head of households and adults. And you're going to collect that at start and every annual assessment that you have to collect. So you'll have to ask, are they a survivor of domestic violence? When was the last time they experienced that? And then are they currently fleeing from that situation? Okay. Now we'll get into the federal partner program specific data elements, and these are those elements that are required by specific programs funded by a federal partner. In our case, it's COC funded, but YHDP has a select group of data elements that they require from HUD perspective, right? So the first one is youth education status. You're going to put sort of where they're at in their schooling. That's going to be for only head of households for all the projects. You're going to enter that at start and at exit. Translation assistance needed. This is a new data element as of last October. It's going to be required for every project, just for the head of household at project start. So it's going to give us a sense of if somebody is speaking a different language and needs some help with that. And there's a list of languages for you to choose from. Sexual orientation is a RIE data element that YHDP has included in their reporting requirements. It's going to be for all head of households and adults. And you're going to either, I put, usually what it is project start. I put record creation because that is also a local requirement that we collect at the profile screen level, which is like the record creation level. So you have 2 opportunities to gather that information. And of course, you can always go back and enter it in once you have it, if you can't get it right away. Formally award of child welfare or a foster care agency. That is going to be for all projects. It's going to be for head of households and adults, and it's only going to be at project start. So if somebody was a former award of the child welfare or of the foster care agency, you're going to put the number of years, and if it's been less than a year, you'll put the number of months. And the same goes for formally award of juvenile justice. So it's for head of households and adult at project start. You have to answer similar questions. If yes, how many years? If less than a year, how many months? So rounding these out, our project completion status. So basically you're going to put on the exit screen for head of household and adult, there's going to be a question that says, what is their completion status? Did they complete the project in whole? Did they involuntarily get terminated for some reason? And then if that is the case, you have to put what that reason is. But there's other options there for you. I have them spelled out here, but we'll look at them in the system. And then safe and appropriate exit. So again, another RIDE data element that got pulled over. Actually, anything that starts with this R number is a RIDE data element that they pulled over. But a safe and appropriate exit, it's going to be for head of household and adults at exit. And basically, you're going to be answering, is the place they're exiting to deemed to be safe by the client or the participant, by the caseworker, and do they have positive connections outside of the project? Both adult connections and peer connections. So just to sort of gauge where they're at within their own sort of community, and do they have connections that will help them be successful outside of the project? Any questions about those? All right. So let's talk about what we've started to, or what we've required locally. These are not going to be looked at by HUD, but this is something that I've spoke with the Reach Board. I've talked with our implementation team. OHS has got together on this, and we basically said, yeah, everything that we've already got is good. But one thing that we don't have enough on is the services that are going to be provided, and we want to know more about that. So these are going to be elements that are required at the local level for head of households only at every point of occurrence. Okay. They're all set up currently as a one-time service rather than a long-term service. So it's just going to be like one date you enter, instead of putting like a date range. We want to be able to see each instance of it occurring. So as I go through this list, I want you to think of a couple things. I want you to think, are there services that we might want to add that you're going to be doing that I don't have listed here? Okay. And then are there differences between SSO and the THRRH project in terms of what we want to track? I've set it up so that all of these things are on each of the projects, every single one of them. But that doesn't mean we can't change that, right? Because this is a local requirement. This is sort of up in the air in terms of how we want to see it at the end. So just real quick, why did we decide to go this route? We want to be able to see that folks are being met pretty regularly. Outside, you probably all track that in like an internal EMR or something like that. But HMIS is that central database that we can then pull that information from. And so we need to be able to see it there. There's also these financial assistance stuff. Like all these are going to have dollar amounts, and you're going to have to enter in the dollar amount that you've provided to each person. That's going to help us. I know we've talked about this a little bit in the NAV collab. I'm sure it's going to come up in the THRH as well, but it's going to help us determine who's getting the majority of the money. Or if there's some sort of cap or limit or minimum, did we get to that point for each of the persons? And again, it's just going to be a central location for us to be able to pull it out and look at it in real time. Okay. So basically what we've done is we split it into two different types of services. We have case management services and financial assistance services. Under case management services, we have the following. We have education, GED, or education services. So linking somebody or helping somebody get their GED, further their education, get a tutor, anything like that, whatever you might be doing that's related to education. Employment and or training services. So linking somebody to, a temp agency, going to job interviews, scheduling job interviews, whatever it might be that has to do with employment. Okay. Housing case management. So how many times are you meeting with them and talking with them about what it's like to be a tenant, housing, getting housing, applying for different things, right? Like housing applications, that kind of stuff. Life skills training. So like ADL work, anything like that. Mental health or medical care. So if you're taking them to a doctor's appointment, or you're helping them schedule a doctor's appointment, or you're taking them to a psychiatry appointment or anything like that. I put a very broad other case management just in case any of these didn't fit. And then the last two, parenting education for youth with children. So if you're working with a family, they have children, you're doing some parenting education or work with them. You could put that in, and then substance use education or prevention services. So that's sort of the right now it's not exhaustive, but that's as much as I could come up with in the amount of time that I had. So is there anything else that you will be doing that maybe is not listed under case management?
Nick, the only thing that I see that stands out right away is driver's license, state ID, birth certificates. But I want to understand, so each time a navigation specialist does any of these things, they should be putting it in HMIS?
Yeah.
Okay.
Yes. So if you're meeting with somebody and you're doing, I don't know, you might do multiple of them at once, which I can see that happening. I really just want to see like one service per contact or engagement or, you know, whatever you meet with that person. It's going to give us a good sense of how often you're meeting with people and then what those services are that they're getting.
And what happens if, oh, I'm sorry, I don't mean to take up,
Oh, you're
I
okay.
see
Go
other
ahead.
hands up, but what happens if the navigation specialist links them with an organization outside of the Nav Collab, right? And they're actually providing the service. How do we document that?
Yeah, so I would just put the service in. I didn't want to go down the referral route. Like there's like a list of referrals
Okay.
that we could say, but I would just put a service in and then there's a note section where you can type in something if you feel like you need to. But I'm okay with even just putting in, okay, yeah, I linked them to Frontline for mental health. And you just put a mental health service in there, right? And I know that was what part of the work you did.
Okay. All right. Thank you.
Christy?
I just had a couple questions. One, parenting education, would that include like helping someone get a daycare voucher? Or like, I'm just wondering where something like that would fit. And then also wondering about things like if maybe we had a category for benefits, something like that, like food stamps, child, like maybe that's where the child care would go. Just thoughts.
Yeah. So I will send out these are like already existing. I didn't make these up. These are existing service transactions. So I can send out exactly what like the definitions are of them. But I'm not really like sold on linking ourselves to those definitions either, right? I really want it to be broad and be like exactly however you all need it to be. So like if you feel like that's a certain, you know, whatever, I can't remember what you said now, but the example you said for parenting education, right? Like if that's how if that's you want to include that, I'm fine with that, right? I'm really trying to get at contacts and then the types of services people are getting to see, because then we can compare that to the outcomes at the end of the day, right? Like if I don't know, are people exiting to a more permanent destination when they receive X, Y, and Z services, and how many times are they receiving those, right? That's the sort of connections we're trying to make here. Carrie?
Okay, can you hear me?
Yes.
So like this list is pretty good, right? However, like thinking about things in terms of more like immediate needs of like food, water, right? So like I know you have the other case management queue,
Mm-hmm.
but I'm thinking more in terms of like, you know, if we're doing education, employment, and life skills, like those are like 10 steps in past the immediate needs,
Okay.
right? So although those are fine, right? Like, but also like life skills training, like rather than calling it life skills, like why don't we, you know, because in that we can also think about like community groups. How are we engaging folks to create community? Because that's something that ends up lacking when folks get housed, right? And then, you know, like if we're making them non specific, like rather than like parenting education, like, you know, just being like parenting resources, right? So then we can be broader in what we're putting in that column. But as I'm looking at this list, like if I was to connect somebody to the food bank, like I would put that under other case management. However, that feels more like immediate baseline needs as opposed to like an other.
Okay, I like that. So maybe adding a case management service for, I don't, should I just call it basic needs?
Yeah, I mean, I would start with, yeah, because like basic needs, like we can, we all start differently, but like being able to provide the food, water, shelter,
Yeah.
like we can start there, and then like when we're getting into education and employment, like that's like kind of when a stabilization has occurred.
Okay. All right. So I'll add that basic needs. I heard instead of parenting education for youth with children, I'll just put parenting resources, make it broader.
Yeah.
And then with life skills, I think that's a good idea too. So we'll take life skills and I'll put like a slash and then I'll just say maybe community building or something like that.
I would be like life skills and community engagement, right? Because you
Engagement.
like life skills training, like, like nobody wants to be like, oh, you have to train me on how to do life. Like
Yeah,
if
yeah.
somebody told me that when I was 21, I'd tell them to walk away from me. You know
Yeah.
what I mean? Like,
Nice of you.
I probably did. You know
Yeah.
what I mean? I got it. And so like when we come to, like housing case management, also like as much as we're housing the way we do it, right? We have applications, we also help,
Mhm.
find, locating, and then also like when I think of housing case management, I think of it in terms of they're housed, not we're getting them housed.
Okay.
Just some
Yeah,
of my
that's
thoughts.
no, that's a good thought. Um, I guess what I'm playing with in my head is, do I just leave it as how like housing, maybe or not case management, but like housing related services, right? And then it could be obtaining housing or maintaining housing, or it could be
Yeah, I think by making it a bit more general, right? Because like even when you see the term like substance use education,
yeah,
like does that mean I'm just giving a safer use kit to someone and educating them? Or am I connecting them to a program that they're going to go through?
yeah. I think both of those would fall into that. So yes, to those.
Okay.
And
Right.
I know that so the language isn't great. Again, this is sort of like this is language that's already in the system. So I'm happy to change some stuff. I've got a few that I'm going to add and edit, so that's good.
And
Um,
then
yeah,
my last question, I'm sorry, I'm taking
yeah.
up a
Are
lot
you
of
okay?
time.
You're okay.
Are we so I'm not visualizing what this looks like yet, but are we like dating like, okay, on 4/4 I engaged with 20-year-old client with housing resources, connected them to the centers, like
It's simpler than that. So
okay.
it's not, you're not going to put any detail. Like this is not a EMR. This is not a case note place. This is, you're going to put a date in that it happened and you're going to select one of these and that's it. There is a spot for a note. If you choose to use that, that's up to you. We're not requiring that, at a local level. It's real simple. I don't want you to get caught. Like, again, it's not a case note. It's really bare basics. Okay. So I got a few things to add there. I see Caleb, your hand is up.
Yes, I just had a question about what is the expected turnaround time for these services to be entered? And I would like to propose, if possible, to make them like maybe monthly rather than like immediately, just for workflow purposes.
Mm-hmm.
Because I think it could be cumbersome to enter a progress note into electronic health record and then also have to log into HMIS to enter this. And I'm just wondering if that will be problematic for efficiency and being able to actually have the time to spend with young adults. Plus, so I don't know how other agencies do it, but at Frontline, like we enter the HMIS data into electronic health record, and then the HMIS work group, which Latrice Campbell manages, then goes in the back end and enters the HMIS data.
Yeah.
So I'm just thinking of like the ODH grant that we have. And Christy can, or anybody else who's part of the ODH grant can speak to this too, that there's services we have to enter, and I think those get turned in monthly. So just wanted to see about that.
Yep, you're
And then
looking.
unrelated to that, it might be helpful to like have a crosswalk like we do for ODH so that we can define what these different services are.
Yeah, so I'm gonna, okay, yeah. The first thing about timeliness, we're gonna get to. The second thing with the crosswalk, I'm happy to provide a very bare basic one with like the case management services and the financial assistance services listed with what HUD has given us as like the definition of those things. But I really want you all to take time to sort of operationalize them for yourself. And I think that will help release the burden too. Like trying to figure out what's what is always a pain in the butt. So I want you to be able to just look at something and know like that this is what I need to enter. So yeah, we'll get to timeliness in 1 second, and then we can talk.
Oh, one other thing, can we have a service that's called adulting? Anyway,
Adulting?
I'll keep myself.
You're not allowed off mute anymore. I'm just kidding. I'm kidding. I mean, is that a serious question or is that just a joke?
Kind of a joke, but like life skills training instead of that. It's kind of like we're helping
Okay.
with adulting.
Adulting. Okay. All right.
You mean like budgeting and stuff like that? Like,
Yeah, exactly.
Yeah.
okay.
That is sort of falls under, yeah, life skills. I used the only example I gave was ADLs, which seemed really like really young child-ish, but yeah, that's really what it's referring to, is like those skills. Adulting is probably more accurate. Caleb, you're right. Lisa?
Yeah. Oh, I just wanted to piggyback on what Carrie was saying about that one, the substance use education prevention services.
Mhm.
I think we could just add treatment, right? Substance use education prevention treatment/treatment services.
Mhm.
And I think that would cover that area.
Okay. Just taking notes.
Does that go for like abuse too? Like if somebody like is using substance as abuse too?
Yes.
Yes.
Yeah, Courtney, that just so for some context for you, they used to have it called substance abuse education. And it's sort of been changed to be a little less extreme to just say substance use, right? So yeah, but that's exactly right. It's for those folks.
Okay, that's what I was thinking about. I'm like, well, it used to be called substance abuse. So is
Yeah.
that okay? Thank you for that.
Uh-huh.
Yeah. Yeah. There's use, there's misuse, there's
Um,
abuse, and then something more chronic, right?
Gary, I saw your hand up. I don't know if that was
No, I think you already covered it where, yeah, DV, since we brought up the word abuse, I went to DV.
okay. I don't have any. I don't know if DV would fall into any of these. It doesn't feel like it.
Okay.
But I guess that
Like,
would
is there,
Go ahead. Sorry.
is there a point of tracking that required?
We do have the DV questions already that
Mhm.
we're answering on the enrollment and annual assessments, but there's no service transaction around that.
Yeah. It might be helpful to have like a referral, like that a place where it says referred to. Perhaps that might be where it would be.
Yeah, because the ODA or ODH grant, you have to list. So it would have all these categories, and then you would select
Yeah.
provided or referred for each
Referred,
of
right?
these.
Right.
Yeah, and I'm thinking also because there's a pathway for housing through our Journey Center,
Mhm.
Rape Crisis Center, like different different entities that aren't a part of this NAB collab. So I'm wondering if it might be of benefit, because those folks could end up our way, and then also depending on what track feels best for the client, they might go that route, right, to
Right.
our Journey or Rape Crisis or I forget the third one.
Yeah. So I'm happy to add it's just going to be a service transaction. It's not going to be a referred to. I want to avoid referrals again because it's not when you get into the referral language, it implies coordinated entry. I don't really want to, get into that. But what I can do is add a service transaction for you that says referred to a DV resource or something of that along that line. Um, because then we can still pull it and track it, right?
Yeah. Yeah, I guess Nick, so coordinated intake, they refer for housing only, right? I'm
Crisis housing
the
and permanent.
referral, yeah, the referrals we're talking about are for like more around supportive services. So would that be the distinction or
Yeah, no,
it's
you're
not?
right. I guess what I'm saying is like in the system, I have to set it up as a service or a referral. And
Okay,
I guess for ease of access to make it easier on you all to find that all in one place would be easier, I think. Um,
okay,
so, and again,
okay.
this is like a local requirement. We could change things as we go. This is a starting point, right? So
Yeah, I got you.
let's start with that. Um, so those are the case management services. I have a few things that we definitely will add. Thank you. This is exactly what I wanted because I knew I wasn't going to cover everything. Um, and then then we move over to the financial assistance. Okay. This is going to be services where you are using the YHDP dollars to provide that service. Okay. So you're not referring somebody to a food bank and putting in a financial service of food, right? You're not referring somebody to a childcare agency and putting in a financial service for childcare, right? It's when the dollars are actually shelled out from the YHDP grant to these particular sets of services. Okay. So I have a few things listed. Again, let's talk about if there's others that you might pay for. I tried to take this from what the application said and what LMM provided to us. So I tried to take as much as that as I could. Um, but if there's other things that are sort of lined out in your budget that maybe I missed, please let me know. So the first was application fees. These are obviously housing application fees, childcare expenses, food. So actually providing money or you can't really do gift cards, but you're providing YHDP resources for food, um, legal fees. Oh yeah, go ahead, Courtney.
I was just gonna say, do y'all know the amount of how much you can use towards that, or will that be up to like the person that y'all helping? That was one of my questions when you was like reading through that.
Yeah, I think Lisa or whoever wants to can speak a little bit more to this, but there is like a budget line item, right? And they know exactly how much money they have in total to spend on these things. And then I know that in some of the conversations they've been having so far, it's sort of we're sort of like throwing around the idea of like a limit per person or a minimum per person or something like that. I don't know if we've landed anywhere with that, but I think that we do have a good sense, at least at a high level, how much money we actually have available to use. And that's sort of what we're going to be comparing all of these when we can pull it out, comparing all those service transactions, adding it up, making sure we're spending right, sort of a way to monitor, right?
Yeah, I think Nick, where we're at right now, we're just thinking it'll be a individual case basis, how the money will be spent with an understanding of like there is an amount that may exceed what everyone is comfortable with, right, for any one individual, but then we would vet that, right, based on the circumstances, based on the individual, that sort of thing. But yeah, yes, Courtney, it'll be on a case by case basis for sure, and we just got to get a handle on what's what's enough, what's too much, that sort of thing. So, without trying to get in the weeds right now.
Yeah.
Uh,
Go ahead, Courtney.
So, not to get like too much in detail. So, what does that kind of like look like if it's different for everybody? But like Nick said, y'all know y'all have a limit. It's not like you could give all that money to like one person. So like in a sense, like you will have to limit it because like you don't want to spend 10K on one person and then you have all these other clients. So like what does that look like for case to case basis? Like say if like I needed help and I have like 2 kids and 1 on the way, I might need a little bit more because not only are you helping me, but you're helping my kids too. And then that will be food for us, but my food, when you spend food for us, might be 600, but if you do it on the individual, it might only be $150 or something like that. So like, what is the limit? Because like, say if somebody with a bigger family or even just their self, because some people have like medical issues, so they might need like medicine resources, transportation to like clinics, hospitals, etc. That might take majority of their money, but like Nick listed, like they might need food, they might need clothes, you know there's other stuff on that list that might be top priority needs. So how will you guys be able to manage that within like the case to case budget, I guess, or whatever?
Right. Yeah. So, and just like you said, we understand that there are different individuals have different needs based on their circumstances. So we'll take that into consideration. And we'll probably pick an arbitrary number. Maybe we'll start out maybe around $500 per person, let's say. Let's say that was what we think might be needed. If somebody comes in and they need more than that, then we'd have a discussion. We take a look at the circumstances, right? And then we make a decision whether or not that makes sense. We're also committed to getting resources outside of the YHDP funds. We know that we're going to have to go outside of that. So we're going to bring additional resources to the table that we might be able to draw from. So we're not gonna be turning down folks or not meeting individuals' needs just because of the dollar amount. We're committed to making sure their needs are met, if that makes sense.
Thank you, Lee. Yeah, go ahead, Courtney.
Oh no, I was just saying thank you.
Yeah, yeah. And I think
Yeah, absolutely.
sorry, Lisa, if I missed this too. I mean, I think for the NAV Collab in particular, you all said you were probably going to be raising some additional dollars too. So, okay. So yeah, I think there's going to be enough floating around, hopefully, that we'll be able to cover everything. And that just did remind me though, as Courtney asked that question, that right now I have everything sort of being billed to the YHDP grant, but if there is a need for you to want to track that other dollars, right? The other dollars you might have, well, we could talk more about that later. Okay. But anyway, so we're going to move through this list real quick. Legal fees was where I left off. So if you end up paying for some sort of legal fee, moving costs, there's a sort of broad list of things that can be considered moving costs, but we'll sort of generalize it there. Rental assistance, pretty self-explanatory, security deposit, transportation and bus passes, and then utility assistance. So that's the list that I came up with. But are there other things you might be spending dollars on that you want to be very specific about? So again, I know there's things that you're going to be doing, but if they fall into one of these categories, that's good enough for our purposes.
What about, wait, hold on. Oh, never mind. It falls under the list.
Okay, good.
Nick, will we have an other box for this as well?
So I was trying to limit. I was trying to avoid it
I
because
know.
I really want to be able to compare it to what is outlined in the proposal and in the application, right? So I want to be able to line it up. Now, if we get to the point, like I think what would be really good feedback for me is as you start to go through this and you're coming across something that you're paying for constantly that doesn't really fall under anything, let me know. I'll just add it in, right? But I'm trying to avoid other for now. Okay.
Got it. Makes sense.
Like
So-
clothes or
Yeah.
something needed for employment, maybe, or something.
I was gonna, Caleb, I was thinking around the same lines of like, again, back to like basic needs, like clothing, like say you get somebody into a rooming house and we don't have any blankets. So like, again, like those basic needs that fall out of line with, application fees or security deposits. And then I wanted to ask a question around transportation.
Yeah.
So when we're documenting that and we're transporting them ourselves, that's when we would account for that in that category. Is that correct?
No, I wouldn't be tracking mileage or anything like that. This is really like what dollars are you giving to the client for transportation purposes?
Okay. Gotcha.
So I hear clothing. I think like when you gave the example of moving into a rooming house, I would throw that under moving costs, like things they need for their new place.
Got it. Okay.
That's
Okay.
why I wanted to leave that pretty broad. And then I do think that you're right. Like, so is clothing, and I didn't see that anywhere, but is that something that's allowable? Is that something you plan on paying for folks with YHDP dollars? Again, so like, Carrie, I'm thinking about, NEOC, and you all have some resources already. If you're just giving somebody some socks or some, the stuff that you already have, you wouldn't want to put that under here and say that you paid for that with YHDP. You know what I mean?
Yeah, no, but there are instances, particularly with trans folks, where like we're gonna go to like Margie's Closet and spend $30 on gender affirming clothing.
Okay. And it's allowable costs under YHDP. I could check. I just don't know if you know that off the top of your head.
I was checking.
Okay,
Yeah.
thanks. You know what I mean?
I'm looking back at the source that you had sent the other day from the Cornell Law School.
Yeah.
And it mentions under outreach services, components and activities that consist of addressing urgent physical needs, such as providing meals, blankets, clothes, or toiletries.
Okay. All right. Then we will add, I think I'm again going to be really broad with it and put basic needs. And then you all can put whatever you'd like in there. I saw Courtney had their hand up. I don't know if we answered the question. Just want to make sure you didn't.
Yeah, you did. I was gonna ask like for females, because we get those times of the month. Where's that like included? Because that can cost a lot.
Okay.
'Cause not only like for the stuff we need, but like medicine wise, some people need like medicine during that time, or a heating pad, or whatever to make them feel comfortable. So I
Okay.
would just, where would that go under? Because I know you have what is it? The mental health and medical.
Yeah, medical care.
I don't know if that would go like directly under there, if you get what I'm saying.
Yeah, so that would be again, so that would be more of like providing a service that doesn't have any financial implication. I think maybe what you're referring to might fall under that basic needs if we add that as a financial service.
Yeah, thank you.
Uh-huh. Tira?
I didn't have a question. Actually, I was just letting you know that I need to leave for another
Oh.
engagement. So I'll access the training off of the website, but I didn't want to just hop off without letting you know.
Oh yeah, no, thank you so much. All right,
All
have a
right.
good
Thank
rest of
you,
your day.
guys.
Bye, Tierra.
Okay. So I think that I have some work to do here. So the last question, and then we'll definitely have to move on, is, I hear a lot from the NAV collab that these apply. I know that the only person, well, you all are sort of working in the THRH space too, most of you anyway. Do you feel like there's a difference in the types of services, or should we just leave it the same and then we just choose what we need to, as we go through?
I'm not in the THRH, but is there anything about like landlord engagement or?
So,
Like housing stability category, maybe.
housing so would that fall under the housing related services that we're going to create for the case
I would
management?
think that's where I would put it if I just had to.
And I think landlord engagement's a good idea, Lisa. The only problem with doing that is that we do this at the client level, and I feel like that's more of like a broad across a lot of
Gotcha.
service, right?
Yeah, no, gotcha. Mm-hmm.
So
I mean, I think this list is pretty good. Like, I was thinking the same thing, Lisa, in terms of like landlord communication, maybe utility resources, but I think all of that can fall under housing case management.
okay. All right. So I'll leave it as is, and we'll keep the same across all the projects, and then we'll probably just leave it like that, right? I mean, then THRH folks, you all can sort of figure out what works for you and what doesn't.
I know this is being recorded, but will you also be able to send us this PowerPoint, so like when we're onboarding folks, we can include like more specific, like this goes under this category kind of thing when we're doing our implementation training?
Absolutely. So I'm going to send this out along with any documents that we go over, like the privacy and the HMIS and all that stuff, right? I'll send it all out at the end.
Cool. Thank you.
Yep. It'll be posted online too. I'll have the slide deck posted on the OHS website too.
Thank you.
So let's go ahead and move on and we'll get into this conversation. So Caleb already teed us up for this. So a note on timeliness is this is what's in our HMIS policies and procedures right now. Okay. NAVCLAB or SSO projects have 2 business days to get the data in from when you find out about it. TH is actually only 1 day, and then rapid rehousing is 2 days. This is straight out of our policies and procedures. Now, Allison joined, so don't kill me, Allison. All right, but we know that this doesn't always occur. Okay, and there's a level of leniency that you get. Okay, especially based on volume, like we get that. All right. I still want to stick to these. Now, with that being said, service transactions I feel are a little different because there's going to be a lot of them. And even though service transactions are included in our policies and procedures as within these timeframes as well, I understand because I've been there before that that's a really heavy load sometimes. So I would like to stick to these timeframes for everything but service transactions. All right. And we can have service transactions be due. You said monthly. I'm thinking I'm rolling this over. I'm just mulling it over in my brain right now. That's fine. And the reason I say it's fine is because we're doing the monthly, we'll go over this in a second, but we're doing the monthly data quality review anyway. So as long as it's in there by the 15th of the month, the next month, where we can have a chance to review it, I'm okay with that. I don't know how anybody else feels about it. Allison, Ebony, I know I'm looking at you both because we have some monitoring to do for this, but
I think that's fair, especially because this is a startup. It's, it's new. I think it could be subject to change, as you mentioned, like once monitoring gets underway and we've established some protocols around that, we might decide to change it. But for now, I think that makes sense.
okay, good. Ebony, I see you nodding your head. You in agreement? Okay.
Yes, I'm in agreement.
Okay.
And welcome back, Ellison.
Thank you.
All right. So anybody, we all good with that? Okay. I better move on before somebody has a problem with it. Okay. So let's get into the quick, I'm going to run through this quickly. Okay. So we're going to do a live demo we're just going to do, I'm going to do the rapid rehousing project because it has all the data elements that the NAVCLAB will have +1. So we're just going to show you like a enrollment process, annual process, and an exit process. So you can see all the data elements and what they look like. Okay. Are you still seeing? Oh, Ebony, go ahead.
I just had a very brief comment. I know that we're working to move away from saying client and using program participant or young adult. So I just wanted to share that.
Sorry, that is literally decades, a decade of that word like drilled into my brain. So yes, it's going to take some second for me to break it, but yeah, I apologize. So we are moving on to this live demo. So are you seeing clarity? Yes. Okay. I'm going to blow it up because I know the screen's a little different. Okay. So let's say we have a client coming in. You've received
Wait, are we supposed to
I
be
still
looking at
see
clarity?
live in your PowerPoint, not the clarity. It's
Oh
just
my goodness. Okay.
I thought I saw it. I'm sorry, I lied.
Okay, hold on. Everyone started talking at once. I was like, you made me panic. Okay. How about now? All right.
Yes.
So All right, you have a new client coming into the project. You received a referral from coordinated entry. Again, this is specific really to rapid housing, but I've went through and done that process for you. So you go, you have your referrals tab. The Nav Collab, you might get referrals, you might not. I don't know how we're going to set that up quite yet. But for the rapid rehousing project, you're definitely going to have, or the THRH, you're definitely going to have referrals coming from coordinated entry. So you see here, Nick Delete was referred to the rapid rehousing project. You can go into that referral and go ahead. Well, you actually can't do anything. You can just see the referral. So we're going to go ahead and open up that client's profile. So these are those universal data elements right off the bat here. You have the social security number. If you don't have it, it's okay. You have to put all zeros. If you do have it and it's not, maybe the person's been created and you have to correct it, you hover over the shield and then hit edit, and then you can edit that social. You want to put the quality of the social security number. So what, is it the full? Is it an approximate? Do you not have it? You enter the name as it's reported to you. For those folks that might be trans or are not using their given name, you need to use their name here. Their chosen name needs to go here, and then you can, if they give it to you, put their given name in the alias. But we want to respect those individuals, and you put their chosen name in the name slots. Okay. Full name reported or partial name, doesn't, whatever you get. Full date of birth reported, and you go ahead and put that in. The system automatically, I need to change this. Oh, that doesn't make sense. What would make you 21? God, I'm old. Why do I keep
2002, I think.
Okay, thanks. Okay.
Nick, quick question.
Sure.
You're using chosen name and given name. So is chosen name your legal name?
The chosen name, no, it has nothing to do with legality. Your chosen name is the name that they have
I
decided
would
to
think that
use.
the name is like the birth name that they've been given, and then like the name that they
First name, okay. Yeah.
yeah
Okay.
birth name,
So-
like their name that they received from their parents, and then they would have selected a new name for themselves.
Yeah. Whatever name they've selected goes in their actual name slots. Okay.
Okay.
So, all right, the date of birth, once you put the date of birth in, it automatically identifies the person as an adult or a child and then gives them their age based on the calculations, right? You can put an alias in. If you have the middle name or a suffix, go ahead and put that in. Gender is multi-select, so you can select whatever applies. Race and ethnicity is also multi-select. You should select all that apply. And then if you have some, if you don't have any information or it's something that's not listed, you can go ahead and type it in as well. So there's a detail where you can enter that in. Sexual orientation, you choose one. You can see the list here. And then veteran status, again, that's for adults only. If they are an adult, conditional logic applies here, and they'll ask you about their veteran history. So if somebody's a veteran, you want to make sure you're collecting, where they served, when did they serve, what branch of the military they served. I'm assuming we might not run into too much of that, but I don't know. I could be assuming incorrectly. On this screen, of course, you have your unique identifier. Please, when you're communicating about clients via email or whatever, use the unique identifier. Please don't be sending names around. That's what it's there for. Over on the right-hand side, there's a couple icons here. I'm going to skip most of them. We're going to go right to the shield. That is the privacy section. Client privacy right at the top. It tells you if this person is public or private. You can't select private if they're already in use by another agency, right? But if they are an unaccompanied minor and you enter them in, so this applies to Lisa and Olivia, I think, that'll automatically be set to private because you're going to be creating them most likely, right? You can select here that the client refused consent. So that would mean that you would basically be putting them in as anonymous, which we're not allowing at this point in time. We're going to move probably that way soon, but really what we're going to do down here, okay, is this is where you're going to add that release of information that we talked about. So you're going to get informed consent from the client. You're going to go ahead in here, add a release of information. Yes, the permission is yes. Whatever date they signed it. So if they signed it on the date that they came into coordinated entry, What it does is, and that's, I only know that because that's when I did it, 4104 or 24, it automatically pushes it out 3 years so that you have that 3-year gap for you. Documentation is really asking, do you have the signed document or did you just get verbal consent? So you want to choose whichever is applicable. If you choose that it's a signed paper document, it's just going to ask, where is that document? Where does it live? And you just put in file, on file, whatever you need to say, but it needs to be on file, right? If it's verbal, it won't ask you that. But as we mentioned before, if you get verbal consent, you still need to have that document that you signed in the record. Okay. So you go ahead and save changes, and that's it. So you don't need to upload that document. You don't gotta do anything with it other than keep it in your records, but this needs to be in there. And now I have access to this record, not access, but now I can enter data in because I have an active release. Go back to the profile tab. Over on the right-hand side, household members. So if you're dealing with families, you're going to have those household members hopefully listed there. If not, you'll need to manage the household and add them in. So when I click manage, you'll have your household member search bar. You're going to search for that person that you're trying to add to the household. Of course, that person won't show up if you haven't already created them. So if you search a name, it doesn't come up. You'll actually have to go back to the search screen, add that client in, go back to the head of household and manage the household, and then you can search for them that way. Once you select somebody, so over here we already got some people. So Nick Delete is the father, okay, and the star next to the name means that person is the head of household, and Happy Halloween is the son. And you can edit that information by clicking on the edit button and changing what member type they are. You can also exit this person from the household if they're no longer in the household. And if you turn that on, you can add a date in. We only recommend that you do that when the family is truly not going to be together at any stage of their time in our system. So what I mean by that is if somebody is referred to or if they go to like single shelters, right? One goes to the women's shelter, one goes to the men's shelter. But they are trying to live together at some point, you want to leave them in as a household, right? Even though they're going to be separate in their enrollments. Okay, so back to the profile screen. Questions about any of that? Okay. So then the next tab, of course, I'm not trying to get too in depth about the navigation of Clarity because you're all end users somewhat already. But the history tab is going to show you sort of what they've already been through or what they have been through in the past in our system. So just taking a look at this screen, you have a program enrollment that's been entered and exited for coordinated entry. They had a coordinated entry supplemental assessment completed. They also received a referral. This is an event, but the referral connects to the event. They received a referral to the LMM YHDP Rapid Rehousing Project. And you can see that that was done on 4/4 and it was pending, which means that no one's done anything with it yet. Okay, it's still out there in HMIS land. Okay. So in order to satisfy that referral, we have to enroll them in the project that they were referred to. So we're going to do that through the Programs tab. And I'm in LMM right now. So think of yourself, this would say, your agency name would be up here and you would see your projects here. So let's say, okay, yeah, we got this person a unit or they're going to be enrolled in the Rapid Rehousing Project now. So I'm going to find that Rapid Rehousing Project. And you can see here just a few details. So how many active clients are in the project? And there's only one active because I actually added somebody else in there just to test it all out. And then how many referrals are pending for the project, what the the funding source is, and then what service categories we've included. You can see here we're in good shape. We're in good shape because it has one pending referral. It's the referral from coordinated entry. You want to make sure this is on. It'll be automatically on. Basically, what this is saying is that it's connecting the enrollment to that referral. So we'll see that chain of connection there, right? Currently enrolled. See, so Happy Halloween's already enrolled. That's the person I enrolled earlier, but so we're not going to include, we're just going to say this is an individual that's coming into the project. So we're going to go ahead and click enroll. And this is where you're going to get all of those enrollment questions. Now, this person already went through coordinated entry. So lucky for you, and hopefully this is how it works Most of the time, a lot of these questions are answered because it cascades from the coordinated entry enrollment. But starting at the top, we want to change the date to whatever the start date is. Okay, we'll say that it was today. Do they need translation assistance? No. Housing move-in date. So this is that one data element that only applies to rapid rehousing. Okay, but this is when they physically take possession of the unit and they're there, right? So let's say that, yeah, they actually have their unit right away. So we're going to put that housing move-in date in. So again, if they don't, it's okay. You can enroll them and then come back to this screen and enter it in when it's time. All right, prior living situation. So again, this got cascaded over. It got brought over from the coordinated entry screen. But if anything's different, feel free to change it. If you've been told something different that doesn't align with what coordinated entry got, that's okay. You can go ahead and change it. But I'm going to leave it as is. But this is that prior living situation. Where did you stay before you came in? How long were you there? The approximate date that this episode has started, and then how many times and how many months in the past 3 years have you been homeless? Who's into disabilities? So does the person have a disabling condition? Yes or no? If I put yes here, that means something underneath it has to be yes as well. So you see here that mental health is checked off as yes. If I were to select no, it's going to give me a little bit of an error message saying, hey, you said they have a disabling condition, but you don't have one in there. So you need to pay attention to anytime you see a yield message come up, okay? So I'm going to keep that as yes. Then you get into that monthly income. So right now it's no, but let's say, oh no, they told us that they do have income. So I'm going to click yes. And now I get all these different types of income. Okay. So you'll choose whichever income applies. Let's say, oh, they actually do have a job. And again, I want to call attention to this. It's monthly income. So we're not putting in annuals. We're not putting in huge numbers. It's what do they make per month? If they're working some seasonal work or they're working part-time and their hours fluctuate, we got to get the best guess. Okay. Do a little bit of math if you can. Okay. So let's say, I don't know, they're making 1,100 a month. Okay. Non-cash benefits. So no, right now we have it as no. Maybe they said yes, and they get food stamps. So I'm going to select that. No dollar amount needed. It's just do they have it or not. And then covered by health insurance. If you select no, you're good. But if yes, you have to select what it is. So I'll just say Medicaid for now. And then we get into those sort of YHDP or RI specific questions that we have to answer. So this got cascaded over from the the profile screen. So we're going to leave it as is. And then we have to, I missed these on my PowerPoint. To go back and fix that before I send it out. So there's general health status. You have to select whether their health status is good, their dental status is good, or whatever it is. Health is general health, dental, and mental health. This is self-reported, so you have to ask the questions. Are they pregnant? Yes or no? If yes, you have to put a due date. I don't know how I missed these ones. Sorry. I need to add these in though. Okay, and then I had these ones. Former ward of the Child Welfare Agency or Juvenile Justice. So if yes, you're going to get some questions about it. If no, you can move on. Same thing here. Okay. And then their sort of education status. So here's the options. They're not enrolled in school or any educational courses. They're currently enrolled, but they're not attending regularly. They're currently enrolled in attending regularly, or we don't know. Okay. And I'll just say that they're currently enrolled in attending regularly, and then I'll ask you, what are they pursuing? If you say that they're attending school. So I'm just going to say high school diploma. I don't know. And we'll save and close. So any questions about any of that?
No.
Okay. Save and close that. So now once I save and close, now we've enrolled them. I know they're enrolled because I have a green bar over here. It says that they are active in the program. We got the head of household's name, the person who enrolled them. So it's going to be you or whoever is doing the data entry. That name will be there. The assigned staff means that you're going to get all the alerts about when annual assessments are coming up due. Maybe if they're something changes drastically in their situation, you'll get an alert from the system. It looks like YHDP is due every year. I thought it was earlier than that, but that's what it says here. Okay.
Here's a quarterly report.
Yeah, I thought that the annual assessment, because like RI is like every 6 months or something instead of
Oh,
a year.
I'm sorry. You meant yes, I'm sorry.
I wasn't sure. I thought I had to wait until I took this to look that up. So then once they're enrolled, okay, they would stay open for however long they're in your program. And this provide services tab is where you're going to find those services that we talked about. Okay. So you see that there's one at the top of the screen that's at the sort of what we call the client level. Okay. We're not going to use that because we want to make sure it's documented under the program. So we're going to go to the one under the, once we're in the enrollment itself, we're going to go into the provide services tab. And there's going to be services listed here. So you have the case management services we talked about. So if you click on that, you get your list. And let's just say, yeah, we linked them to mental health. You just having a date. You can put a note. Again, it's not required. And then you save it. You submit it. And you'll see down here your service was placed, right? It's that simple. Boom, right? Your history will show here that they received that service on the date that you selected. Anthony, go ahead.
Hey, sorry. So quick question. Is it the same process? So like, let's say we got a young person in THRRH, they have like a child. Um, with LMM, we would just give LMM the documentation to add them to the HMIS, or should we ask the service provider to add the child to HMIS?
The child.
Yeah, like a new member of the household. We'll
Yeah.
just say new member of the
So
household.
yeah, that's so for THRH specifically, that's going to go through LMM only.
Gotcha.
Yeah. So you want to just let LMM know that something has happened or changed, and they'll have to get that in.
Perfect.
To
Thanks.
confirm, follow up on that question, all HMIS entry has to go through LMM for THRH, correct? Okay.
Correct.
Thank you.
Right. The financial assistance is the same, okay, except for one thing. So if I click on financial assistance, let's say I'm going to pay the rent this month. It's a one-time event date and the expense date. You can keep them the same. Okay. This means nothing to me really if they're different, but just put the date that you paid the rent, what that expense amount is, I don't know, $1,000. And then it's already going to be selected as the funding source as LMM, the YHDP grant. And you can submit it. All right. So now you can see at the history tab that they received that service. There's a dollar amount associated. You can hover over it and you can get a quick glance at what that is. But that's how you would provide services. And again, you're going to do that as you go, right? So you'll come back to this person every time you meet with them and provide the service as you see fit. Okay. Or, on a monthly basis now that we've decided that.
Is that also the area where we would provide like receipts?
No, you're not going to
Okay.
upload any documentation in here. You're going to have to keep that all on file. And then I guess I'm going to leave that up to Lisa or LMM in general to figure out how they want to handle receipts and all that. Okay. I got to move through this quickly. We have 20 minutes left. I haven't even gotten to reporting. So we're going to get to annual assessments. So the folks who have been in your project for more than a year will require an annual assessment. Once that year, so you have to do the annual assessment within 30 days of their anniversary into the project. So this person will have an annual assessment due within 30 days of 4/4 of 25. And it's 30 days either way. So it could be 30 days before, it could be 30 days after, but it has to be within the 30-day of either side of the anniversary. And you'll see, I'm just going to show you what it looks like. It's very similar to what you see on the enrollment assessment. And you will make updates there as you become aware of them. Okay. And then let's say we're going to exit the person because they've moved out or they've moved on, whatever it is. There's an exit button here. You'll add the exit date in and then the destination. So again, this is where HUD's going to be paying particular focus to where people are leaving to. let's say, okay, this person ended up having a rental with an ongoing subsidy, and it's going to ask you what that subsidy is. So we can just, I guess it would be without a subsidy by the end of the project. I don't know. But so just if there is a subsidy involved, you'll want to select what that subsidy is. Okay. If there's no subsidy, you won't have to answer that question, right? Project completion status. So did the person complete the project in its entirety? Did they voluntarily leave early, or were they expelled or involuntarily discharged? If you select that, which I don't foresee happening often, you'll have to select why, right? Okay. And then you'll update this information again as you can. At the bottom, you're going to have those questions about the safe and appropriate exit, which we already talked about. So do you deem that exit to be safe? Yes or no, I'm sorry, does the client, or now this is the HUD language, so I'm sorry, it says client, but this is the participant. Participant is, do they deem it as safe? Yes or no? Does the caseworker or the staff at the project level think that it's safe? And do they have positive adult connections and positive peer connections and community connections outside of the project? So I think I might have missed one of those too. And then you would update their schooling status. And then you would save and close. And that would close them from the project. Once you close somebody, you cannot go back in unless you reopen them. And I mean, like, remove the exit date. You can't enter any other data, like other services or anything, while they're closed. You'll have to reopen that project enrollment, enter the services you need in, and then reclose it. Okay. So I zoomed through that, but are there any questions about that?
I have
No.
a really quick question about annual assessment
Okay.
because I can't remember. Do you have to do one for every member of the household or just the head of household?
Yeah, it's everybody. So if it was a family, when you click on the annual assessment to complete it, there will be a pop-up that has the family members listed, and you'll just switch them on with the head of household, and then you'll complete it for the whole family. Yeah. It's a good point too. So if there's a, like, to Anthony's question earlier, if like a kid gets added and they don't get added until 6 months after the head of household did, the annual for that particular kid, even though they entered 6 months after, is still the anniversary of the head of household. So you want to just do it all at the same time. Okay. All right, let me stop sharing. I'm gonna breeze through. I'm gonna breeze through the reporting. Okay. So everyone should be seeing where it says live demo. Yes. Yes. Okay. All right. So let's get into the reporting requirements. So you will have, well, like I said, okay. So OHS is the primary reporter to HUD, right? All the data is going to flow through us because we are the recipient, and we're going to report it out to HUD. We have reports due on a quarterly basis. Our first one's going to be due at the end of April, even though we haven't served anybody, which is okay. And we have an annual report. It's going to be due. We don't really have the due date for that yet, but it's usually due at the end of the year, right? After the end of the year, after the end of the year has come and gone, usually they give you about a month to get in your annual report. Both the QPR and the APR are uploaded into Sage, which is just a repository. You might be familiar with it, and we'll get data validation errors or things like that we'll have to fix up from Sage too sometimes. So basically with that, your only requirement is that all of your data be in before I turn it in. And then you're basically saying it's not going to change from here on out. Okay. So, as we start to serve more people now, our next quarterly report will have people in it. Once we've uploaded it, it cannot change. So you need to make sure that it is up to date and accurate through the end of that quarter. Okay. The other thing that you're going to be doing that you actually have more of an active role in is the data quality monitoring process. So if you already have projects with me, you know that this is a requirement already. But you have a monthly report due to me, to OHS, I should say, on the 15th of every month for the previous month's worth of data. Okay. So this month, everything will be due on 4/15, but it's for the month of March. Okay. So you're going to send me the month of March report by the 15th, and then I'm going to review it and return it to you, or return a list of people to you that says this person has this problem, fix this, fix that, whatever. Okay. Then you're going to have 7 days from the time that I give it back to you to fix those problems and get it back to me. You don't have to really resend the report again. Just let me know, hey, I fixed those things, and that'll suffice for me. Okay. So this is a requirement of all HMIS participating projects, not just you all as YHDP. So I'm doing it for the entire continuum, is what I'm trying to say. What this means is that you have to have your data in, okay, by the 15th of every month for the previous month. Okay. Now, we already went over the time frames. You have very specific time frames for your projects. We set a time frame for the service transactions, but at the very least, you have to have everything in by the 15th of the next month, so that when I'm reviewing it, I know that that's complete data set for the month, and I don't got to worry about going back later on. Okay. Okay, real quick, this is the APR. I'm gonna show you an APR in just a little bit, but this is just a real quick breakdown of what is required with the APR for each of the projects, and you can see it's really similar. The only thing that's different is that THRH is going to have a bed and unit count with it, whereas SSO will not. But basically, this is the stuff that we have to turn in Sage. So this is just giving you an idea of, it's not just your data. There's a lot of other stuff that we have to collect or report out on. There is a supplemental tool, which I'm not going to go over because that's really, again, on my end. But basically what it is the APR only has the HUD required data elements. The RI funded or the YHDP funded data elements that we talked about aren't on the APR. So this supplemental tool helps them get that information. So that's why it's equally important, even though you're not going to see those data elements on the APR I'm about to show you. Okay. I think there's another, yeah, there's some more here. This is the QPR. So this was the APR, sorry. Let me go back. This is what's required annually. Okay, it's a pretty good list. And then this is what we have to do quarterly. It's shorter, but still we have to do it every quarter. Okay. Okay, let's look. I said I'm going to show you the supplemental. I'm not going to show that to you. Let's look at an APR real quick. So I'm going to go over how to do the APR because I know not everybody has run one before, but under the menu options, I'm going to hit reports. Okay, it's going to bring me to my report library. I'm going to go down to HUD report.
We're not seeing
You can't
Claire.
see. Yeah, of course.
I was just gonna say, how we're supposed to be.
I don't use Zoom very often. Can you tell? Usually I'm like pretty good with Teams, but decided to switch it up. Okay, clarity now. Okay. Okay. Menu options, reports. Okay. It's going to bring you to your report library. And down here under HUD reports is where your annual performance report is going to be. It's called an APR, but this is the same APR that we do for the QPR. Okay. It's the same report. If I'm you, I would star it, because what that does is favorite it, and then it saves the parameters that you put in. So next time you don't have to fill everything out. It's just whatever you ran last time. I'm going to click run. You can see there's also a schedule function. You can schedule them to regularly pull and send to you. Okay. So you can do it that way if you want. I usually run them as a one-off. So I'm going to go into run. At the top, these are the parameter screen, right? So the top, I'm just going to stay as Lutheran Metropolitan Ministries. The COC filter category will be agency COC, because our COC only covers one geographical area. So it's OH-502. And then we're going to look at the project type. For the sake of having data in the project so we can look at it, I'm just going to pull LMM's shelter project real quick. But you would obviously go down to either services only, if in they don't have it, but they don't have it under there. This would be under like Lisa's project, right? Would show up as services only, and then you'd see YHDP, right? Or for this RH project, so then the project shows up down here. Okay. But like I said, for the sake of having data, we're going to look at their 2100 men's shelter project. Apply enrollment COC filters should be defaulted to no, and it should stay that way. We're not going to base it on any funding criteria when we pull it on a monthly basis. And let's just look real quick at last month's data. And so report output format basically is saying you're telling the system how you want to see it when it runs. The web page format is going to come up as a tab basically within your web page, and that allows for what's called a drill down. The drill down is where you can click on the numbers and you can see who falls into those categories. If you select anything other than web page here, you won't be able to see any detail on people within the project or within the report. So I'm going to keep it as a web page. And then when it comes to drill down output format, I'm going to leave it as web page. What that means is when I click on a number within the report, do I want it to come up as another tab as a web page format, or do I want to see it as a CSV, or it's a fancy term for Excel spreadsheet? If you're trying to manipulate data or do some data analysis, I usually would do CSV, right? But I'm going to stick with web page and submit it. The report will run. You can do whatever you need to in the meantime. Just keep in mind that if you're doing anything, like if you ran the report on THRRH and then oh man, I got to go and answer this one person I forgot about, they're obviously not going to show up on the report because it's running with what was ever current when you ran it. But you can work while you go. So up here in the top right-hand corner, there shows up a graph icon or chart icon, and that's your report queue. And you can see that report is running. It's processing right now. When that number turns to 1 and it has processed, that means it's ready to go. So I'm going to go ahead and open it. Might take a second because I'm sharing my screen. Okay, so I'm going to again really go quickly through this. I'm happy to have more. I can schedule more time with all of you if you really want to go over this in depth to go over what you need to be looking for. But I think most of you are pretty familiar, I hope, with what an APR looks like. So basically at the top, you have all the parameters that you just put in, and then you get into what I call the Q boxes or Q charts. They have all these different Q numbers or identifiers. So if I give you a list of something, if there's a problem, I'll give you the ID number of the client, and then I'll put the Q number in saying, oh, this is where I found that error on the APR. Okay. Q4A is all about the project itself, who the organization is, the project that we pulled, the project number. At the very end, you have total active clients and active households, which you see my mouse switches to a pointer because I can now click on those numbers and see who those 643 people are. I'm not going to do that because it'd be huge. Q5A is all your aggregate data. So how many people you served, how many people left, how many people stayed. What that means is how many people at the end of the reporting period are still active in the project. How many of them are veterans, how many are chronically homeless, so on and so forth. With your projects in particular, I'm expecting that the number of youth under the age of 25 equals the number of head of households. So, you want to pay attention to things like that as you go through. Down here is the number of child and unknown age heads of households. We don't want to see anybody there unless they're unaccompanied minors, that they are the head of household and they will show up there because they are a child, right, as the head of household. Q6, there's a few of them. Q6 is all the data quality checks that we go through or that the system takes you through. How many people, said they didn't know or didn't answer, what their universal or the PII information, personally identifiable information, If you see anything in the information missing or the data issues columns, I would check them out. So as you run this before you send it to me, the expectation is that you're running it and you're looking at it. And so if you're seeing anything in those two columns, you want to check out those people. So I see one person here, data quality issue or data issue with the social security number. If I click on it, the tab opens and I can see exactly who that person is that has a problem. And I can click on the ID number and hop right into their profile to see what the issue is. Okay. Q6B talks about some of those universal data elements. So we see everything's pretty clean there. That's good. Q6C, income and housing issues, destination. So that means that 205 people we didn't know where they went. So that's what, Robbie and his team probably put in. And it's going to show up as an error, but we know that that's just the nature of the beast sometimes. And so that's okay. I would still be checking anything in the information missing or data issues columns. One thing just to point out real quick, there's program applicability identifiers here for every single one of these Q charts. So if it says all projects, it obviously applies to all projects, but sometimes it lists very specific shelter types or project types, I should say. So if it doesn't have your project type in here, you can ignore it, basically, is what I'm trying to get at. So I'm going to keep sort of scrolling through here. Q7 gets into sort of people served, household served, point in time counts, things like that. I see that we're a minute late, or we're almost there. Gender, so you have all your genders listed, and counts of people that have identified as those genders. Age brackets. You can see that in almost every, you'll notice as you go through, almost every single one of these Q charts has two rows that I always pay attention to. The client doesn't know, prefers not to answer, and the data not collected. If there are numbers in there, I would check them out. See if we have the data. So even in this person might have said, I don't want to tell you what race I am, or I just, we couldn't collect it. It's still there, and we still want to try to enter it in if we get it at a later time. Okay. Same thing with age, same thing with race. So there's all these different Q charts have these two rows. Almost all anyway. Then you get into the disability condition and disabilities and like mental health conditions. And it's all at different points in time. Sorry, I'm zooming through this, but you want to check those out, make sure everything lines up with what you think is true. Previous living situation. Hope nobody's getting dizzy. And so again, those two same rows, cash income ranges, same two rows. Okay. It's all about cash income. This chart is particularly important because it talks about people throughout the stages of their time in your project. Did they maintain their did they maintain their income that they had when they started? Did they gain income? How much did they gain? How many people gained, right? So that's stuff that we look at too. This is just interesting look at, household composition, disabling conditions, and income sort of intersectionality there. Something pretty interesting to look at if you want to. Non-cash benefits, health insurance, length of time in the project. Here you have your average length of time in the project. Length of time between project start and housing move-in date doesn't apply to a shelter project, but there is like this section here where it talks about like, have they moved into housing yet, right? And then the last is the exit destination where all of those are aggregated and totaled. At the very bottom of that chart, you can see percentage of persons exiting to a positive housing destination. I know it doesn't look great, but this is shelter, so it's a little different. We would obviously expect it to be a little higher for some of our projects, right? And then the rest of this is all just like subpopulation data, but all of the same stuff that you saw up top. Okay, so we're 2 minutes over. I know that was really, really quick. But thank you for your time. I really appreciate it. Are there any other questions before I go ahead and stop recording?
I was gonna say, can you take additional time to like go over that last part with us again? Maybe like as the YA board or individually, I don't know, but like, could you do that?
Yeah.
Like that thing?
Yeah, we want to schedule some time outside of this.
Yes, please.
Okay, I'm happy to do that.
Thank you.
Latrice, I see you came off mute. I didn't know if you have a question or.
No, no question.
Okay. All right. So, now I'm like releasing you to the wolves, right? Let me stop. Let me stop sharing and recording.